We begin this hour, though, by talking about healthcare. You could lose your family doctor just for living in the wrong region. That's one of the new restrictions in Bill 106, Quebec's controversial health reform that many doctors are saying would jeopardize both the healthcare system and patients. Critics say it's a threat to patient care, could leave thousands without a doctor. Let's head over now to Andre Fortin. Liberal M&A represents the riding of Pontiac, the official opposition critic on healthcare matters. He's on the line. Monsieur Fortin, welcome back to the program.
Good morning, sir.
So let's talk about what Bill 106 does. I saw you talking about this on X the other day. What does this bill do? Why should we all be concerned about it?
So Bill 106 is the bill for which you've probably heard a lot of tension between doctors and the government. The health minister being out there saying doctors don't work enough. Mm-hmm. They stop working at 4 o'clock on Friday afternoons. And doctors have not, I think, appreciated the way that the government has put the debate forward. But what the bill actually does, in the broad lines of the bill, is it changes the way that doctors are paid. So right now they're being paid for every visit they see or every surgery they do. This would change it to a system where doctors are paid in a mixed way, sometimes for the visits they see and sometimes for the number of patients that they take on. The other thing it does is it basically takes a global responsibility. For example, that 100% of patients get their surgery within their surgery within a year, or that every Quebecer has a doctor, puts the onus of that on doctors themselves and says, we will dock your pay X percentage, up to 25%, if we don't meet those standards. Mm-hmm. But there's a lot more than that once you start digging into the bill, and that's what we started doing last week when the government put it forward. And there is a provision in there that says that people will lose their family doctors if they don't live in the same region where that doctor practices. But that same region can be Montreal and the South Shore, Montreal and Laval, and there are quite a few patients across Quebec who don't live in the same region as their doctors.
Which is crazy because, someone who lives in Laval, let's say they work in Montreal, it's more convenient. For a lot of people, that just makes sense for them.
Well, it's more convenient for a lot of people. People can move for all sorts of reasons. Say I'm an elderly person. My daughter sets up on the South Shore. I want to go live with her. Why would I have to lose my family doctor to do that? There's a family doctor in my building where I work in Laval. Why would I have to lose my family doctor because I live on the island of Montreal? It makes absolutely no sense. This, to us, is an example of government trying to make rules that work for government, but that don't work for people.
So let me ask you this, Mr. Fortin. This is a tougher question because you were bringing about you talked about doctors and the hours they work and some of the things there. Isn't it true that not all, some doctors don't work enough, and there should be some sort of mechanism to get some doctors working a little bit more?
There certainly are some who do not work the same hours as some of their colleagues. There absolutely are some. And the doctors' associations have looked into this over the years as to why some of these work more hours than others. There are some reasons which are perfectly legitimate. A 68-year-old doctor who's thinking about retiring, who wants to keep working 3 days a week, I would rather they work 3 days a week than retire altogether. Mm-hmm. I would rather they slow down their practice, work a few days a week if the option is they're going to retire. Some of them, absolutely, they may be taking additional courses. They may want to go back to school for something. They may be in a transition back to work from, maternity leave or whatever it may be. Sometimes there can be reasons for that. But to do what the government is doing and to say, I'm taking my responsibility as a government for people to have their surgery on time and putting the onus of that on the doctors themselves, when government is the one who's not providing operating room time, who's not providing them with enough nurses so that they can operate, that makes no sense whatsoever.
Let me ask you, next year's a provincial election year, right? Obviously, all the political parties are going to have to prep for that. The CAQ is pushing through this bill without debate. Is there a party that says, if you feel that this bill is going to be such a failure, let them do it. Let them make their own bed and make the case to Quebecers that they failed on health care?
Well, here's the problem and in a theoretical world, that could work. But in the real world, there are patients that will be suffering. There are people who will lose their doctors. And it does not make sense that you would have to lose your doctor just because you're in Sainte-Anne-de-Bellevue and they're in Vaudreuil. And that's the everyday impact of Bill 106. So sure, they are saying they're going to ram it through. They're saying they're going to adopt it without debate. And there's always part of us that are part of people who analyze public policy who want to say, okay, well, let them fall on their own sword. But there are people behind this who will lose services, and I don't think that's what anybody wants, really.
To wrap up here, Mr. Fortin, I just want to get your take on the current state of the Quebec Liberal Party leadership race. There was another debate last night. I got to be honest, we haven't covered it much today. I don't see a lot of coverage of that debate. And you're supporting Charles Milliard.
I am.
So why don't you just tell me what you saw last night and how you think the race is going?
Well, there have been 4 debates, I think, up to date. Last night was a debate that was on public services. So there's a lot of healthcare policy that was actually debated last night, which was a good thing because healthcare isn't working in Quebec. So to hear the different propositions from candidates, I think was positive. It allows members to make an opinion for themselves. And I was pretty happy to see Charles Milliard come out with forward-looking propositions on healthcare that can have an impact. And we have to look at the way, amongst other things, that some of our healthcare professionals are treated. It's not normal that a healthcare professional, a nurse, for example, cannot think about having family or vacation at Christmas with her family for years and years when they enter the system. That's the kind of thing that, because we consider ancienneté the most important thing, leads a lot of young nurses to leave their positions. That's the type of things that we have to look at if we want to attract healthcare professionals to our healthcare network. And so I'm happy to see that the candidates to the Liberal Party are putting forward practical propositions that can have an impact to help Quebecers get better healthcare.
And getting closer and closer to the finish line of that race.
I think everybody's happy with that. It's been a long race.
It has. Mr. Fortin, thanks so much for joining us on this Friday. Have a good weekend.
Yeah, you too. Thank you.
Andre Fortin represents Pontiac, official opposition critic on healthcare.